Oh, you say you want a revolution. Well, perhaps you're getting it when it comes to Quebec's healthcare system. I'm calling it the most extensive overhaul ever, right? Has there been a bigger overhaul? We'll find out in a few seconds. We'll get the take of Aaron Derfel when we talk about Bill 15. And, Christian Dubé, the health minister, at times he was using biblical terms and biblical messaging discussing Bill 15. Well, it will certainly create something biblical. Santé Québec, I'd call it omnipotent, right? An omnipotent agency that will be tasked with making healthcare in Quebec more efficient. It's going to decrease the amount of unions. It's going to try and create flexibility and mobility. Let's find out, because when we were thinking this morning, who do our listeners want to get a take from on this reimagining, on this revision, this revolution in Quebec healthcare? And at the top of the list was Aaron Derfel, health reporter at the Montreal Gazette, and he's graciously accepted our invitation. Aaron, welcome back to the show.
Good morning, Elias.
So, what's your take on Mr. Christian Dubé and his attempt at doing what some would say is the impossible?
Well, I'd have to say that, as someone who's been covering healthcare for more than 25 years, I'm suffering from a certain degree of reform fatigue because it's the third major reform of the healthcare system in Quebec that I've covered. And each reform has these ambitious goals, and then what happens is the healthcare system continues to deteriorate. With this reform, it's just so complex. It's very hard to figure out. People are still, poring over it. I spoke with Eric Maldoff, the former head of Alliance Quebec, and he's still trying to assess the implications for the delivery of health services in English. I did speak with a patients' right advocate who expressed concern that the voice of patients may be muted because a patient's representative is not going to sit on the board of directors of Santé Quebec. And then, as I pointed out in my column today in the Gazette, there are these two big issues that Bill 15 does not address. One, of course, is the chronic shortage of staff. There have been record departures of nurses in the system, nurses who were burnt out, during the pandemic. The bill doesn't address that. And then there's just the issue of funding. The government is spending or will spend $59 billion. That's a tremendous amount of money. It's the biggest single line item in the budget. Mm. But believe it or not, the government increased spending by 1.5%, well below the rate of inflation. And it took some of the increased money that it got in federal health transfers to dole out income tax cuts. So it raises questions about the government's true priorities. Another thing that I noticed about the bill that I found odd is that I scanned for the word patient. I found just 4 references in nearly 300 pages, and then I typed in the word private, and I found more than 200. So that's another odd thing that I noticed.
Okay, so one thing I want to get to here is the whole union and employer issue here. So everyone's going to have one employer, right? Santé Quebec, yes. That will be the employer, and 136 unions to 4. You brought up the previous revisions, and I think it's so easy to say, oh, man, 40 years of bad healthcare in Quebec, nothing's going to change. But when I hear about that, right, the single employer, the reduction of the unions, that seems to be a monumental thing that could make, maybe, things better when it comes to the flexibility and the mobility that at the end of the day, a lot of employees are pining for. What's your take on that aspect?
Yeah, I agree with you, Elias. I think that this is, you don't want to you don't want to slam this bill entirely. There are some positive elements, and the health minister, Christian Dubé, he was talking about, right now there are 34 CISs and CISs, so 34 different employers. And if you make Santé Quebec the single employer and you reduce the number of unions or that you're dealing with, or it's just better collective bargaining, that could make things efficient. And you could have workers, seeking employment in other regions or keep their seniority. This will make the system less sclerotic, more efficient from that perspective. That's one positive thing. The other positive thing, too, is that the health ministry, if you look at an organogram of it, it's just mammoth, right? I mean, they do compare it to that, to a gigantic mastodon, and it the idea is if you have alongside it this agency that just focuses on the day-to-day operations, maybe you could get things done. That's the hope.
And is there anything, Aaron, that you see in this bill that you would define as audacious, like that you can't believe they're even trying it?
I just find Santé Quebec to be audacious. I mean to give an analogy, say you've got a house that's beginning to fall apart. Maybe you should raise the house and start over. Well, the Quebec healthcare system it's like a dilapidated house, and with Santé Quebec, it's as if Dubé were building a new house right next to the dilapidated house, and so I find that to be audacious. I also find, as I mentioned before, this idea of perhaps creeping privatization. Dubé is favoring the construction of two mini hospitals, one in Montreal, one in Quebec City, one to focus on pediatrics, one to focus on geriatrics. And he's pointing out, that it would all be covered under Medicare, but these would be private for profit facilities. And the idea is they would want to recoup their investments. So would they charge extras? Would there be these ancillary fees? So I find here this is a center-right government. What is their true agenda? The government is strapped for cash. It's opening the door to more private delivery of healthcare. And that's something that has to be monitored very carefully. I'll definitely be looking out for that.
We're with Aaron Derfel, health reporter with the Montreal Gazette, getting his take on the massive reform announced yesterday by Christian Dubé, the health minister, and Bill 15. So let's talk just a bit about Christian Dubé, Aaron. What is your take on, how much the buck stops with him, and how much are you going to be looking at him over the next, maybe in the next 6 months to 12 months as to, getting some traction here and getting some movement on his priorities?
I've covered, I think he's the 7th or 8th health minister I've covered. François Legault at one point was a health minister. Mm-hmm. Like François Legault, Dubé is a chartered accountant by profession. He's worked in business before he jumped into politics. He was a pulp and paper executive and had also worked at a bank. And he's a numbers guy, and he's very pragmatic. I think that he's following the ER situation more closely. There are lots more numbers. I'm working on a sort of another, I guess it would be the fifth part of the series that I'm doing on ERs. And he's, I think, to be applauded for that. On the other hand, some critics have pointed out that if you set up, Santé Quebec, it'll be easier for someone like Dubé to pass the buck. If something goes wrong, he'll be able to fire the CEO of Santé Quebec. Yeah. So again, it's just creating this second, structure in addition to the health ministry that may be just a bit too much for the system.
Let me ask you a question here that is a touchy one, Aaron. Unions, help or hindrance? What's your take on navigating the unions when it comes to delivering great health care in Quebec?
I think that Dubé wants to reach deals with them, but when he uses rhetoric like invoking Amos 1:9 in the Bible and talking about shaking the foundations, you'll recall that passage in the Bible. It's about disobedient Israelites. And that I don't think would work well with the unions. These massive federations, but I think he's trying to make things more efficient. It's just that I think from the union's perspective, they feel that they've been betrayed after so many years, and sure, it's all about power too for some of the unions. So there's just going to have to be, I guess, more collaboration, more of a positive attitude. Although, as I said, what Dubé unfortunately has done, he's undercut that by using this almost inflammatory rhetoric. And the former health minister, Gaétan Barrette, was saying that the other day that Bill 15 is going to usher in a World War III in the health sector field. So I think he still has a lot of work to do to improve labor relations.
Aaron, we're going to leave it there. I want to thank you so much for coming on the program. Some of that color that you put into your piece in the Montreal Gazette, one of the reasons why when I was thinking about how to define Santé Québec, I came up with an omnipotent agency is because you went biblical in your piece. So I said, all right, let's think about a sort of God all-knowing being to describe this agency. Thanks so much for the spark plug on that.
My pleasure.
That's Aaron Derfel, health reporter with the Montreal Gazette. When we return on the Elias Mackos Show, we're going to speak to Dominique Olivier from the city of Montreal. You know, sometimes we throw out really tricky, difficult subjects for our City Hall segment, and sometimes they suggest to us we want to talk about the touchy stuff, and that's what we'll do next. We're going to talk about racism and discrimination on City Hall next.